All right, are you ready for this? You wanted to do a deep dive on fentanyl. And wow, did you send us some intense sources this time? Articles, videos, all these scary statistics. We've got it all.
It's a lot to unpack, for
But
sure.
that's what we're here for, right?
Absolutely.
Break it all down, help you make sense of it all.
That's right.
And I gotta say, one thing that really jumped out at me from all this material was this statistic about how fentanyl is the leading cause of death for Americans aged 18 to 45.
Yeah.
That's
Well,
that's huge.
it is a very sobering statistic, and it really underscores the seriousness of this crisis we're facing.
It's like, I don't even imagine a whole football stadium packed, you know? That's the scale we're talking about.
Yeah, and what makes it so dangerous, like you were alluding to, is just how incredibly potent fentanyl is. It's a synthetic opioid, but it's many, many times stronger than heroin.
So it's kind of like a supercharged painkiller, right?
Exactly.
But if it's a painkiller, if it was developed for medical use, how did it become such a widespread problem? Like, how did we get here?
Well, yeah, you're right. Fentanyl was actually first created, or synthesized, I should say, back in 1959 by a Belgian doctor who was looking for a fast-acting and super powerful pain reliever for patients. And it actually is still used legitimately in hospitals today
So it does have its uses.
for things like anesthesia and to manage very severe pain.
Okay, so it is a powerful tool when it's used correctly.
Yes.
But how did we get from that to it being the leading cause of death?
Right.
For young adults, something clearly went wrong.
Yeah, well, you see, the problem is that fentanyl's effectiveness as a painkiller is also kind of its downfall when it's misused.
Right.
You see, it triggers this huge flood of dopamine in the brain, creating this really intense feeling of euphoria, which is, of course, incredibly addictive. And because such a tiny, tiny amount of fentanyl can be lethal, the risk of overdose is incredibly high.
That makes sense. And then on top of that, we've got all this talk about a fentanyl war with China. Our sources suggest that, well, they suggest that China's almost intentionally flooding the U.S. with all the chemicals needed to make fentanyl. Kind of like, and I can't believe I'm saying this, but it's kind of like what Britain did with opium in China back in the day.
Yeah, it's definitely a complex issue and a hotly debated theory for sure. There's certainly evidence, I mean, there's no doubt about it, that China is a major, major supplier of the precursor chemicals that you need to make fentanyl.
Right.
And some people argue that they're basically exploiting, America's opioid crisis for their own geopolitical gains.
So they're intentionally trying to weaken the U.S.
Well, there are some who believe that by fueling this opioid epidemic, China could, undermine the U.S. in a number of ways, like its workforce and the economy.
Yeah.
But it's really important to say here that this is just one perspective, and it's extremely controversial.
Yeah. Our sources definitely made it clear that just blaming China is way too simple.
Right.
Like, it's not the whole story.
No, absolutely not.
There's more to it.
Yeah, I mean, there are so many other factors at play here. We have the overprescription of opioids by doctors in the U.S. We have all the socioeconomic problems that lead people to be more vulnerable to addiction.
Right.
And of course, we can't forget the influence of powerful pharmaceutical companies.
Yeah, like the Sackler family.
Exactly.
That whole oxycontin thing, right? They just pushed that drug, even though they knew how addictive it was, and made billions while the opioid crisis was exploding.
The Sacklers and Purdue Pharma are a prime example of how corporate greed can really fuel a public health disaster.
It's infuriating, honestly, that they profited off so much suffering. And now with fentanyl, which is even stronger and easier to get, it feels like we're in an even bigger crisis.
Yeah, I mean, absolutely. The fact that fentanyl is so potent, combined with this existing opioid epidemic, it has created like a perfect storm. But, before we get into those specifics, I think we should address a common myth that often gets blown out of proportion.
Okay.
And that's this idea that simply touching fentanyl can kill you.
Oh, yeah, I've seen those stories online, like the police officer who collapsed just from touching it, supposedly.
Right, right. It's scary stuff, I know. But honestly, there's not much truth to it.
Really?
Yeah. While fentanyl is incredibly potent, the risk of absorbing a lethal dose through casual skin contact is extremely low. In
Oh.
fact, for that police officer, experts believe his reaction was probably due to stress or maybe a pre-existing condition.
So it was more about the fear and less about the science.
Pretty much.
Yeah.
It's really crucial to be informed by reliable sources and avoid those, sensationalized stories that don't really reflect the reality of fentanyl exposure. What's really important to understand is how fentanyl's effects on the body differ from other opioids and how those unique effects contribute to its danger. For example, one disturbing phenomena we're seeing more and more is something called the fentanyl fold.
Okay, fentanyl fold.
Yeah.
That sounds intense. What is that?
Well, you've probably seen those videos online of people frozen in strange positions, contorted after using fentanyl.
Yeah, those are hard to watch.
They are. It's really heartbreaking. And yes, that's from fentanyl.
Wow.
This fentanyl fold is a result of how powerfully the drug impacts your muscle control, your motor function. It causes these involuntary contractions and spasms, leaving people contorted in these really painful positions.
Oh, wow.
Imagine,
No.
just imagine your muscles seizing up, making it impossible to stand or even lie down comfortably.
That's terrifying to think about.
It's a really horrifying side effect that highlights just how devastating fentanyl's impact on the body can be.
For sure. But we're also seeing all this discussion about where fentanyl came from and its journey from this medical marvel to, well, the crisis it is now. Can you take us back to the beginning? Like, how did this all start?
Sure. So as I mentioned earlier, fentanyl was first synthesized in 1959 by Dr. Paul Janssen. He was a Belgian physician.
Okay.
His goal was to create this painkiller that would be more potent, faster acting than morphine. He saw it as a game changer for treating acute pain, in patients undergoing surgery or dealing with conditions like cancer.
So it really was intended as a medical breakthrough.
Exactly. And it still has legitimate uses in medicine today. But fentanyl's powerful effects, including that intense euphoria produces, made it ripe for abuse.
So that's when it started to become a problem.
Yeah, the qualities that made fentanyl so effective as a painkiller, its potency, its ability to induce euphoria, are the same qualities that made it such a sought-after drug in the black market. And as the opioid epidemic was taking hold, fentanyl emerged as this cheaper, much more potent alternative to heroin.
And that led to...
And that, of course, led to this huge surge in overdoses and deaths.
And now we've got this influx of fentanyl from China.
Right.
Which just makes everything even more complicated.
Absolutely. The Chinese connection adds this whole other layer of complexity to an already multifaceted crisis. And to truly understand it, we really need to dig a little deeper into the geopolitical factors that are at play here.
All right, so let's dive into that. What's going on with China and fentanyl exactly? Is it like a deliberate strategy? Or is it just, a consequence of their regulations being kind of lax?
Right.
And how does this fentanyl war compare to what happened with the Opium Wars?
Well, those are some big questions.
They are, but I think they're important.
You're right, they are. And to really answer them, we need to go back in time a bit. Understand the historical context that's shaping this modern-day conflict.
Okay, let's do it. Take us back.
So to really understand the parallels between, the so-called Fentanyl War and the Opium Wars, we need to go back to the 19th century to when Britain was really pushing opium into China, forcing China to open up their ports to British trade and, flooding the country with opium. It was really devastating for China, those wars, like a really dark chapter in their history.
And now people are saying China's doing the same thing to us, to the U.S., with fentanyl. It's a pretty serious accusation.
Yeah, it is. And it's super important to, be careful and nuanced when we talk about this topic.
Yeah.
I mean, there's no doubt at all that China is a big player in this fentanyl crisis.
Right.
But the question of, intent, that's way more complicated.
Okay.
Some experts do think there's some kind of a deliberate strategy going on. Others say, it's more about economics and just a lack of, regulatory control within China.
So is it a deliberate attack or just that they're not doing enough to stop it?
That's the question, right? The million-dollar question. And honestly, it's really hard to say for sure. There's evidence on both sides. You've got the historical context of the Opium Wars, which, it kind of suggests maybe China's trying to get some, historical revenge.
Kind of a scary thought when you put it like that.
It is. But then there's the other side, the idea that maybe this is more about, just making money, just profiteering. Fentanyl, there's a huge demand for it. And China can produce it cheaply. It's classic supply and demand.
So maybe it's a bit of both. They see an opportunity and they take it, but maybe there's also some, some deeper political strategy going on in the background.
It's definitely possible. It's almost never just black and white in situations like this, right? But whatever their intentions are, the impact is undeniable. I mean, fentanyl coming from China is making this public health crisis in the U.S. way worse. And something needs to be done.
You're right. But, like we said earlier, just pointing fingers at China isn't going to solve everything.
Nope.
We need to look at our own problems too, right? Here in the U.S.
100%. There's a whole bunch of stuff going on right here within our own borders. We talked about overprescription of opioids, but there's also the whole issue of addiction itself.
Right.
We got to treat that like a public health crisis, not some kind of a moral failing.
Yeah, and that means, like, providing more access to treatment, to
Yeah.
support services.
Yeah, absolutely. Things like medication-assisted treatment and harm reduction strategies, those are crucial.
Okay, so tell me more about harm reduction. What is that exactly?
Harm reduction is a more practical approach,
Yeah.
right? It acknowledges that people are going to use drugs whether we want them to or not.
Yeah.
So instead of trying to stop all drug use completely, harm reduction trying to minimize the bad stuff that comes with it. Make it less dangerous.
I've got to admit, I'm a little, I don't know, skeptical of that. Doesn't that just mean we're enabling drug use?
Yeah.
Wouldn't it be better to, focus on getting people to stop using drugs altogether?
I get it. I totally get why you'd think that. It's a common concern. But here's the thing. Just telling people don't do drugs doesn't really work.
Yeah.
You know?
Yeah, I guess that makes sense.
Addiction, it's complicated. It's a disease. Abstinence, quitting completely. It's not always possible for everyone, at least not right away. And harm reduction recognizes that. It's like, okay, people are going to use drugs. What can we do to make it safer for them while they're doing it?
So what are some of those, harm reduction things you're talking about?
Well, one you've probably heard of is needle exchange programs.
Right.
Give people clean needles so they're not sharing, which helps reduce the spread of things like HIV and Hep C.
Okay. Yeah, that makes sense.
Another big one is providing naloxone. It's a medication that can actually reverse an opioid overdose.
I've heard of that.
If you give naloxone kits to people who are using or their friends and families, they can actually save someone's life if they overdose.
Wow. So it's like a first aid kit for overdoses.
Exactly. And then there are things like supervised consumption sites where people can use drugs, but it's in a safe, clean space, and there are medical professionals right there if anything happens.
Supervised consumption sites, isn't that kind of like a controversial idea?
Yeah, it can be. People think it's like we're saying drug use is okay.
Yeah.
But studies actually show that these sites reduce overdoses, they reduce public drug use, and even crime. And it's a chance for people to connect with healthcare workers, with social workers.
So it's not just about letting people use drugs safely, it's about connecting them with help too.
Exactly. Harm reduction is about meeting people where they are, offering help, not judgment.
I'm seeing how this could be really helpful, but it sounds like there's some people who don't like this idea.
There is, yeah, definitely some stigma around harm reduction. One of the biggest problems is just that people don't really understand what it is. Yeah. There's a lot of misinformation out there.
Just how do we fix that? How do we educate people about harm reduction?
We got to talk about it.
Okay.
Honestly, openly. Drug use, addiction, these are things we need to talk about without judgment, without shame. They're public health issues.
Yeah, I think you're right. We've got to change how we think and talk about drugs and focus on solutions that actually work, that are proven.
Exactly. And harm reduction isn't just about helping people who use drugs. It's about helping society. When you reduce the harm from drugs, you're reducing the strain on hospitals, on the police, on our communities.
That's a good point. So what's next? How do we make these harm reduction strategies happen when there's so much pushback?
Well, it starts with educating people, advocating for it. We need to get the word out about what harm reduction really is, how it works, and why it matters. We need to bust those myths, give people accurate information.
Like changing minds, one conversation at a time.
Exactly. And then we need to fight for policies that support harm reduction. Decriminalizing drug possession, funding for those needle exchanges and safe consumption sites.
Right.
Making sure everyone can get naloxone.
That's a lot to do.
It is, but it can make a real difference. And remember, we're not alone in this. There are tons of organizations, so many people across the country fighting for this, trying to save lives.
It's good to know we're not alone in this. This conversation has really, opened my eyes to harm reduction.
Yeah.
I'm starting to see how it could really make a difference with this fentanyl problem.
It's a huge part of the solution. It might not be perfect, but it's an essential tool.
We've talked about so much today, from where fentanyl came from to the politics, the drug companies, this harm reduction stuff.
A lot to unpack.
It's complicated, that's for sure, but I feel like I actually understand this crisis better now.
I'm so glad to hear that. And I hope this is just the beginning for you, Keep learning, keep talking about this.
I will.
It's important.
Yeah, this affects everyone, whether they know it or not. We all have to be a part of the solution. So, what's the one thing you want our listeners to take away from this deep dive? What's the most important thing you want to leave them with?
I want them to know there's hope. This fentanyl crisis is bad, really bad, but we can beat it. If we work together, if we're open to new ideas, if we fight for solutions that we know work, we can make things better.
That's a powerful message.
And it's especially important for people who are struggling with addiction, or if you have someone you love who's struggling. Help is out there, and it's okay to ask for it.
Absolutely. Recovery is possible, and there's always hope.
Yeah, it's inspiring to hear about the people out there working on solutions and holding on to hope, even with, everything we've been talking about is pretty heavy stuff.
Hmm.
But yeah, is it something else we talked about earlier that I've been thinking about is the role of pharmaceutical companies in all of this. Where do they fit into this whole mess?
That's a really important question to ask. I mean, the pharmaceutical industry, particularly companies like Purdue Pharma, the Sackler family, they have a huge responsibility for the opioid crisis in the first place, which kind of set the stage for fentanyl's rise.
Right. We were talking about their marketing of oxycontin.
Yeah.
But how did pushing that drug lead to the fentanyl problem we have now?
Well, their marketing tactics were unfortunately very successful. They basically downplayed how addictive OxyContin was. They pushed it as a safe, effective painkiller, even when the evidence showed that it wasn't.
And this, of course, led to a lot of overprescribing of opioids. And it created like this huge number of people who became dependent on these drugs.
So they created a market for opioids, and then when those became harder to get or more expensive, people turned to cheaper, more available stuff like heroin
Exactly.
and eventually fentanyl.
Yeah, they basically like primed the pump for this current crisis. And when you consider the profits they made off of this while people were suffering, it raises some serious ethical questions about like corporate responsibility.
It's just wrong that they made so much money while people were getting hurt. So how do we hold them accountable? How do we stop this from happening again?
Well, there have been lawsuits, some settlements, but a lot of people feel like true justice hasn't really been served. Some folks are pushing for stronger regulations, like on how drugs are marketed and how doctors prescribe them.
Oh, okay.
Others think that criminal charges should be filed against the people responsible for, misleading the public and making this crisis worse.
It's complicated for sure. There are no easy answers. But one thing is clear. We need to talk about the role of the pharmaceutical industry in this and figure out how to prevent this from happening again. How do we keep them from profiting from people's pain?
You're absolutely right. And that conversation needs to include the ethics of, creating and selling drugs that are so addictive.
Mm.
We have to carefully weigh the benefits against the risks and make sure that we're not, creating more harm than good.
That's a good point. It's not just about fixing what's broken. It's about making sure we don't break it again in the future. And speaking of solutions, I'm interested in hearing more about those safe consumption sites we talked about earlier. Can you tell us a little bit more about how they work and why they're so important?
Yeah, safe consumption sites, or sometimes they're called supervised injection facilities.
Mhm.
They're basically places where people can use drugs, but it's in a clean, safe environment. And there are medical professionals there to supervise, in case something goes wrong. They have sterile needles, and the staff are trained to deal with overdoses. They can administer naloxone if needed.
So it's kind of like a clinic, but for people who use drugs.
Yeah, kind of. But it's also much more than that. They offer counseling. They help people get into treatment programs if they want that. And they even provide, like, basic health care, like wound care, vaccinations, things like that.
So they're really focused on meeting people where they are, helping them, not judging them.
Exactly. And there's a lot of evidence showing that these sites are effective. Overdoses go down, the spread of diseases goes down, and even public drug use goes down. They also connect people with the help they need.
That's really incredible. But I bet there are a lot of people who are opposed to this kind of thing, right?
There is. There's definitely resistance.
Yeah.
Some people see it as condoning drug use, but that's really not what it's about. It's about saving lives, reducing the harm.
So we need to do a better job of educating people about what these sites are really about.
Absolutely. There's so much misinformation out there that it's preventing us from using this tool, this really important tool to save lives.
Well, this deep dive, I gotta say, it's been a real eye-opener. I feel like I understand the fentanyl crisis so much better now. The science, the politics, the role of those drug companies, all the harm reduction stuff.
I'm glad to hear that. And I hope it's just the beginning of your exploration of this issue.
Oh, it definitely is. This is an issue that affects all of us, whether we see it or not. And it's up to all of us to be part of the solution.
I couldn't agree more. We need to come at this with a sense of urgency, with compassion, with a willingness to try new things. What we're doing now isn't working. We have to be bold. We have to be innovative if we want to make a real difference.
You're absolutely right. Well, that wraps up our deep dive into the world of fentanyl. It's been a challenging conversation, but I think a really important one. And as we've seen, this is just the beginning. There's so much more to learn and understand about this crisis.
Yeah, and I would encourage everyone listening to keep researching, keep learning, keep talking about fentanyl and this opioid crisis. Your voice matters. Every action you take, no matter how small it seems, can help make a difference.
That's a great message. Thank you so much for joining us today. It's been an honor to have you on the show.
It's been my pleasure.
And to our listeners, thank you for tuning in and for being willing to explore this difficult topic with us. Remember, knowledge is power. And by understanding this problem, we can start to find solutions. Until next time, keep learning, keep asking questions, and keep fighting for a better tomorrow.